Good afternoon. First, I would like to start with a clip from last night's board meeting where I gave an update on the current situation. So the CDC, when I was on my first call on this on March 15th, thanks to Mayor Lightfoot put this together for the regional mayors, we actually didn't hear from the state for a couple weeks after this. And they gave us a lot of information. And the CDC, what they told us then is, they said there's really four things they look at during an outbreak. So it was very informational. One is they look at morbidity, so how many people die from it. As they said at the time, there's really not much they could do about that because there was no known treatments, so that was going to be what it was going to be. Of course, they would look for treatments, but they didn't know anything that was going to work for it, so that was really something that, while they would look for treatments, they weren't expecting. The second was spread and how fast this thing spreads. Now, this is back on March 15th when we had only a couple cases in the state of Illinois, and the words were that the cat is out of the bag on this, and we're going to have a pandemic. So that was back on March 15th. I know it wasn't declared a pandemic by the WHO for several weeks after that, but they said at that point they knew it was out of Wuhan. It was there was no way, the way this was spreading, it was not going to be a pandemic. So they said they were really focused on the last two levers, which is protecting the healthcare system and balancing that against the economic damage that those any actions you take cause. So protecting the healthcare system, we all have heard this over and over again for the last 2 months. It's flattening the curve. So that's what protecting the healthcare system is. And what does that mean? I think a lot of people misunderstand what that means. It doesn't mean that you're going to have less cases. It means you're going to have less cases at one time. But if you look at the spread of time as you flatten that out, you're still going to have the same number of cases unless you come up with some kind of a cure or vaccine, or somehow it peters out and mutates into something else and doesn't spread as much. So the idea is to spread that out, and the reason you're doing that is because you don't want the healthcare system to be overwhelmed. Because what they're concerned about is getting so many people to come into the healthcare system that people that would otherwise live from this, if they were treated for their symptoms, don't live. So because they just they can't get into the healthcare system. So that's the idea behind flattening this out. It's not to prevent deaths. It's, as the CDC put it, it's to prevent preventable deaths. So that's really what they're focused on with this. And so we've done a great job doing that. It's come at great cost to the economy. Again, the goal was preventable deaths. We have done that. So as you know, other states have been opened up for several weeks with no significant issues. These are the ones that I could get relatively quickly, get their and that's not, I'm sorry, that's not hospitalized by report date. That's actually number of cases. So I apologize for the header on that. That's incorrect. But as you can see, Indiana's been a little bit, it's been flat the last 2 weeks. Actually, it's down from where it was 2 weeks ago when it opened. But you know, so they're monitoring that closely. You can see Iowa's done the same thing. It's dropped and then kind of leveled off. And then Georgia has continued to see a decline. We're not going to see a giant decline to zero here when we reopen. The CDC is not expecting that. No one's expecting it. What they want to see is something like this, something that's manageable. The healthcare system still does not get overrun. So then you can move to the next phase and the next phase. And we're fully open. We may still see a curve like this because the healthcare system can absorb that. That's the key. So this is not about going to zero cases, and people that think that it is, that's just not what this is about. Because the whole time we stay closed, we continue to damage our economy. As we all know, we just saw the numbers. It's affecting the village. It's affecting some of our residents. They're unemployed, et cetera. So the goal as you reopen is not to bring it to zero cases. It's to keep it flat or slightly declining so that we're not seeing a spike. And so far, Indiana, Iowa, and Georgia have seen that. Go ahead and flip to the next page. So the governor has indicated that there are four different regions. He's used the 11 emergency management regions, and he's combined them into 4 separate regions. This is where the majority of the state, in fact, the entire state, except for the city of Chicago, is not happy with breaking it into 4 regions, because what it does for us in our regions, it ties Chicago into our region. So for us to advance to the next phase, Chicago has to figure out what they're doing. And Chicago right now has 21% of our state's population approximately, and it's got 39% of our cases and our deaths. So Chicago was the one laggard of meeting all the metrics. Everyone else was meeting it, and especially the people downstate. A lot of those counties don't even have a case. And so they're obviously very upset with everything being held back. It does make sense to go into regions. I think the IML has asked for that to be in the emergency regions, which are the 11 different regions, which would put us outside of the city of Chicago. So that's one of the things that we've asked for. If you move on to go to the website. So we're going to show you now the metrics. So these are the metrics currently. Every region, so this is our region, we meet every metric the governor has set forth to move forward to the next step. This is the governor's metrics, the IDPH site. Flip down a little bit. So there's the rest of the metrics. So we meet them all. If you keep rolling down, so the entire state meets this, and that includes the city of Chicago. So again, the metrics are met, and back to the impact on the economy that this is having, every day that we delay when we've met the metrics, it's that much slower till we return to normal. Because we know when we open, we're not going to see a rush of people. So that first week, 2 weeks, we're seeing it in Georgia, Florida. There's a slight uptick in activity, but it's not everyone rushing back. So that's going to take some time. So the sooner we can do this, the better. Flip to the next page. So one of the governor's metrics is testing percentages. So testing percentages across the state have averaged 12.2% positive. Now, we can't see the testing percentages for just suburban Cook County, unfortunately, but that's the statewide. We can see it for Orland Park because we have been tracking this for almost a month. We're at 12.7% specifically in Orland Park, so we're well below the governor's threshold. And you can see going back to like April 24th, there's only like one day that was above 20, and it's actually an average over 14 days. So we're well below that on the testing. Now, I personally don't like this metric for a couple reasons. It can be manipulated either way. You can do less tests and test people you know are sick, and it's going to bump that percentage up. You can do a lot of tests of people that you know aren't sick, and you bring that number down. So I don't think that's the best indicator that we have. One of the things that Orland Park is tracking and that we're tracking as part of our back to normal plan, flip to the next page. I think this is a better metric. It's hospitalized by report date, because what do we really care about? We really care about who's really sick. Who needs to stress our hospital system? Back to the flat curves, we know that the hospital is going to see cases. So if we're testing more, we know that the numbers are anywhere from 10 times to 20 times more people have this than we've tested for because they're asymptomatic. If we're testing a lot of people and we're catching all the asymptomatic cases, that's great. But that's going to show a lot of cases. But they're not going to end up in the hospital. It's going to drive that hospital rate way down. And as long as the hospital's not being overrun, that's the key thing. So this is a 7-day moving average of the hospitalized by date. And you can see, and this is for suburban Cook County, so it takes out Chicago, but it includes all the other suburbs, except for a couple that have their own health departments. So if you look back to the beginning of the month, we're in a steady decline. We're less than half of what we were at the beginning of the month. And if you look back a week prior to that, it was, higher still. So we're down, a third of what we were 3 weeks ago. So we are in a steady decline on that. So that's good news. That's exactly where we want to be. So flip to the next page. So another one of the governor's metrics is ICU bed and ventilator beds being stable or declining. So that's so it's a little bit subjective on that. But if you look across the state of Illinois, and this holds true in our region as well, but we just can't see the data. We just can talk to the hospitals and get the feel for it because we don't get this data reported to us. If you look at the beds, it's stayed very stable and slightly declining. We did have a spike here earlier like 2 days ago, but that may be an anomaly in reporting because everything else is definitely going down. Flip to the next page. So another one of the governor's metrics is that we have to stay above 14% ICU bed and ventilator bed availability. And that makes sense because we don't want the hospital system to be overtaxed. So we want to keep watching that as we open up. As you can see, ICU beds and ventilators have met this threshold for over 3 weeks. That's how long it's been being reported. So it's probably a month that this, or more, that this has been good. In fact, there was only maybe 2 or 3 days that this really became a problem, and that was when the Stateville prisoners were dumped out into St. Joe's Hospital in Joliet. When that happened, it taxed our system for a few days until the National Guard got put up some tents and some medical facilities at Stateville, and then we returned to normal. So as you can see, Ventilators, actually, there's so many ventilators that they've stopped reporting it on some of our reports that we get because there's so many of them. So it's not really an issue. So at the end of the day here, we meet all of the metrics. It's time for us to move to the next phase. And it's not because we're rushing things, it's because it's a balance. It's a balance between the economic damage and the harm that we're causing people with all of the increased mental health issues, suicide issues, all those things that we just talked about, abuse, all of those things, people being out of work, all of those things, we have to balance those versus the healthcare system. And the whole goal of this was to not overrun the healthcare system. We did not overrun, we did a great job. We did not overrun the healthcare system. We don't want to keep trying to do this in perpetuity, or we will absolutely destroy our economy. And then you won't have a healthcare system because you won't be able to afford to pay for it. Flip to the next page. Here's the big failure of the state, and we're not the only state that failed in this, but a lot of states did. Long-term care facilities represent 49% of the deaths in the state of Illinois. In Orland Park, they're 100% of our deaths. So we have 25 deaths. They are all in long-term care facilities, according to the IDPH website. This is the thing about long-term care facilities. The state is solely responsible for the oversight of those. It's not us. It's the state that's responsible for this. So if you think back, there was a tragedy with the Legionnaire's disease in Quincy. 13 people died. We heard about it for 15 months, and it was a tragedy and needed to be fixed, no question about it. This is 2,000 people. 2,000 people, and we're not getting nearly the coverage that we should in this. This is a travesty. Flip to the next page. So we know that, I don't think anyone's shocked by this, that people over 60 are the targets of this disease. The disease really does a lot of devastation to people who are older. The CDC, now they report it from 55 and up, so that if 55 to 64, 65 to 74, so it's a little bit different. But 92% of all deaths are over the age of 55 for COVID, and that's actually not through 5/2, that's through 5/13, so that's through just a few days ago. So that number's held pretty steady, and I don't think it's going to change a lot. Move to the next page. Cook County and Illinois data confirm that COVID becomes even more dangerous with age. What you see on the left there is hospitalization by age. So if you get COVID and you're over 80, there's a 51% chance that you are going to end up in the hospital. 46% if you're 70, and then on down. So you can see it's much more dangerous for those who are older. The morbidity rate, so the death rate by age, if you're over 80, 44% chance that you're going to pass away from this. And there's only a 51% chance you're in the hospital. So you can see that it's very, very dangerous the older you are. One of the things that concerns me about the governor's and the state's Restore Illinois plan is that the CDC actually says in all of their recommendations for all of their phases that until the economy is fully reopened, that people over 60 and who are immunocompromised shelter in place as much as they possibly can, and that long-term care facilities do not receive visitors. The state's plan completely fails to address this, which, given the fact that 49% of our deaths are in long-term care facilities, and this is how much death is in the older population, that's just unconscionable to me that that's not in there. Now, that's something we've asked for. So several mayors sent a letter to the governor asking that this is changed, and so hopefully he'll take that under consideration and adapt his plan. Like all plans, they're not perfect, and they can be adapted. Flip to the next page. So I'll go back to, we've met the metrics for about 3 weeks now. It's time to open. We've accomplished the stay-at-home order. We're not overwhelming the healthcare system. The governor established new metrics. We've met those. Other states have started opening. They haven't seen significant case increases, if any. We've got to keep watching that. If we see places where they're spiking, it looked like Florida might be creeping up a little bit. We got to see why. Where are those tied to? What's causing it? Maybe there's something different that we have to open in a different way. Nursing homes represent almost half the deaths in Illinois in all of Orland Parks, and this virus is significantly more dangerous to people who are older. And the state has failed its vulnerable citizens, and the plan ignores them and fails them again. I can tell you that our plan that we've put together, we emphasize this very action, and you're going to hear more tonight. We're going to talk about the resolution, but part of that resolution is to direct staff to look at every option we have available to us to try to regulate the long-term care facilities as much as we can. It's not something that municipalities typically do, but maybe there's some things we can do. So we're gonna really dig deep on that to try and figure out what that is. After that presentation, we had a long discussion that ultimately resulted in the village board passing with a 6-to-1 vote a resolution calling for the following: clarification on the governor's authority to act under the Illinois Emergency Management Act, provisions for the reopening of business and civic life with reasonable and specifically targeted public health guidelines by June 1st, 2020, drawing regional boundaries based on hospital capacity rather than IDPH regions, and affording adequate due process for any municipality, corporation, or any individual resident of the state of Illinois or any business in the state of Illinois to appeal any stay-at-home restrictions or shutdown order based on their individual capacities. We also authorize the commencement of research to create detailed options for the village to either join existing litigation or start separate litigation. These options are to be presented at our next board meeting on June 1st, 2020. Lastly, we authorize staff to research the village's oversight options, if any, for long-term care facilities within the village boundaries. As you all know by now, the reason for the stay-at-home order was to flatten the curve. The goal of flattening the curve was to ensure that the healthcare system was not overrun and we did not have any preventable deaths. It was not to eliminate deaths. Sadly, flattening the curve delays deaths, but it does not stop them. Back to my very first conference call with the mayor of Chicago and other mayors, we learned that the CDC was not focused on morbidity because there were no known treatments. They were hopeful we may find one, but we're not planning on it. The good news is that we have flattened the curve and the hospitals have plenty of resources available. In fact, it works so well that hospitals have been furloughing medical staff, which is definitely not good for the healthcare system. For this reason, we now have to consider how to reopen the economy. However, we need to do it safely. There are a few factors that the General Assembly should consider when they go back to work: the U.S. and Illinois constitutions, balancing the integrity of the healthcare system to ensure there are no preventable deaths with the economic system, data, logical consistency, and faith in the American people. First, the Illinois and U.S. constitutions. By Illinois law, the governor can declare an emergency for a time period that shall not exceed 30 days. Additionally, that law expressly forbids him to utilize local law enforcement or fire departments from enforcing those laws. The enforcement arm for this emergency declaration are the emergency management agencies. His emergency order has now been in place for 71 days and the stay-at-home order for 59 days. His legal authority has long been exceeded. Many of us have given him latitude on these days due to the situation. However, after 30 days, the appropriate body to legislate this issue was the General Assembly. Unfortunately for the people of Illinois, they have been AWOL until recently, but it's heartening to see that they are finally going back to work this week. The people of Illinois, and specifically the people of Orland Park, need representation, which we haven't had. That leaves it to the mayor and the board to provide that representation. I sent letters to the governor on April 10th, April 17th, April 24th, May 5th, and May 8th. The only response we have received back was on May 6th via email. I followed up on that email and have received no response. It is time for the General Assembly to provide the representation we need. The state has failed to protect its most vulnerable. 49% of statewide and 100% of Orland Park's 25 COVID deaths are in long-term care facilities. The state is responsible for these facilities. The state also has failed to provide a safety net for many of the unemployed, 1099 workers, and the self-employed, in spite of receiving funding from the federal government to do so. And now it even appears the personal data of many of the 1099 workers has been compromised by a flaw in the state system. Lastly, the state has provided no PPE for our first responders or our medical workers. The Village of Orland Park stepped in to take care of this need when the state failed. Until now, the Village of Orland Park has been on its own. We are optimistic that this will no longer be the case, but the legislature needs to act. Second, balancing the integrity of the healthcare system to ensure that there are no preventable deaths with the economic system. Some people have tried to make this about livelihoods versus lives. We all care about saving lives. Anyone who says differently is deceitful, lacking the ability to make intelligent arguments, and is deflecting to hide their own inabilities to offer solutions to the problems at hand. As we know from the CDC and previous pandemics, new viruses take lives when there's no known treatment. That's hard to hear, but it is the truth. Instead, we try to make sure that the healthcare system is not overwhelmed so that there are no preventable deaths. The goal was to flatten the curve, not eliminate the virus as the governor seems to now desire. His goal of either a vaccine and effective treatment or no cases may never be attainable. First, a vaccine is well over a year away if we ever have one. How many viruses do we never have a vaccine for? Second, an effective treatment may also prove elusive for decades. It took us that long to find an effective treatment for influenza. Third, no cases is entirely unrealistic. In the history of mankind, only one human virus, smallpox, has ever been eradicated. That took 200 years of dedicated effort, including a worldwide vaccination program. In order to have a viable healthcare system, we must also have a viable economy to help pay for that healthcare. A depressed economy puts enormous strains on the healthcare system and could actually cost more lives than the pandemic due to suicides, depression, abuse, lack of health insurance, lack of preventive care, etc. This is not about lives versus livelihoods. We must open the economy because that will save lives. Third, the legislature needs to look at the data. As you saw from my presentation made at last night's board meeting, the Village of Orland Park meets every one of the governor's metrics. In fact, so does the entire state. The goalposts keep being moved. It's time to stop talking about following the data and the science and actually follow it. Orland Park residents and businesses, and in fact the entire state, should be allowed to return to normal. Fourth, the legislature needs to look at logical consistency. The orders given to date have been logically inconsistent. Here's some examples. Many businesses deemed essential were questionable at best. Big box stores can open, but small mom and pop stores that compete with them are forced to close. 20,000 people per day go through Orland Park's essential retail stores. Over the last 8 weeks, there has been one case identified to those stores. If that can be done safely, what sense does it make to have all of our retail stores closed? Golf courses can have 32 people on them at one time, which is one person per 5 acres in the outdoors. That's the equivalent of one person in a Costco at one time. Golf courses can't rent pull carts, but grocery carts can be used over and over again. Why can non-essential retail stores not take cash, but a fast food drive-through can? Why can hundreds of thousands of people vote in one day, but otherwise everyone needs to stay at home? Why are community charitable organizations considered essential, but churches are not? Why are some of the governor's metrics 14 days and others 28 days? Why 28 days when the CDC and every expert recommends 14 days phase to phase? These things don't make sense. The legislature needs to act. Fifth, faith in the American people. The American people are resilient and they generally do the right thing and are conscientious of others. An example of this occurred before the stay-at-home orders. Restaurants were already seating half as many people on their own. Movie theaters were socially distancing their seats. People were taking extra time to sanitize their gym equipment, etc. Americans are smart people with many incredible talents. We can open the economy while simultaneously keeping people safe, provided we keep the people of Illinois informed with facts and data and information rather than mandates and threats. With all this in mind, it is time for the General Assembly to act and move every region in the state onto phase 3 immediately. Upon doing so, they also need to work with the governor to modify and improve the Restore Illinois plan as follows. The timing to move from phase to phase needs to be reduced to 14 days as recommended by the CDC and health experts. The goal to move to the final phase needs to align with the goals to move to other phases. The goal of complete eradication is not realistic. Restaurants need to be moved to phase 3 with capacity limits rather than in phase 4 as they are currently. Lastly, and most importantly, the legislature must take action to protect our most vulnerable citizens, as the state has failed to do to date. They need to ensure that Restore Illinois follows the advice of the CDC. All vulnerable people should continue to stay at home until we return to normal. No visitations at special needs long-term care facilities or hospitals until we return to normal. I cannot overemphasize the need for the vulnerable populations to take personal responsibility for ensuring their own safety by staying at home as much as you possibly can. The residents of Orland Park and all the citizens of Illinois are hopeful that the legislature does their job and does it quickly. We have done what we were asked to do. Now it's time for the legislature to do the right thing and be a check and balance to the executive branch that has gone too far. Also, I ask everyone to be considerate of others as we start getting back to normal. Compliance with the request is voluntary, but this virus is dangerous. But we must live with it among us, as it will be here a long time. The better we voluntarily follow the recommendations, the more likely it is we can move on to the next phase. The majority of the village board and I believe in personal freedoms and trust you all to behave responsibly, provided we keep you informed. Let's show the rest of Illinois how Orland Park can rally together, do the right thing, and get the economy moving again. We are not only the leader of Chicago Southland, we are leaders for the entire state. Thank you and good afternoon.